Ladies and gentlemen, hospitals are looking for ways to keep their facility open with all kinds of staffing issues that are just getting worse. Now, we know they let a whole bunch of medical personnel go recently, and the few people they got left are calling in sick. So, many hospitals across the country are now cutting the amount of beds that are available based on staffing issues. So let's say your hospital has 32 beds. They may cut that in half. So that means they will only be able to take a limited amount of people at a time. So, mm-mm-mm. So I guess they're going to have to do whatever they can to stay open, which is still going to be a very difficult thing. So a rising number of nurses and other critical healthcare workers are calling in sick across the US, forcing hospitals to cut capacity just as this is just something you're going to start seeing as commonplace from now on. Hospitals are leaving beds empty because the facility don't have enough staffers to safely care for patients. And a tight labor market has made finding replacements difficult. Staffing shortages prompt the Mass General Brigham Hospital system in Boston to keep 83 beds empty on Friday. The University Hospital System in Ohio has closed as many as 16% of its intensive care beds recently, while uh, Parkland Health and Hospital System in Dallas has shut 30 of 900 beds. It's definitely a brutal situation, said Dr. Joseph Chang, chief medical officer at Parkland, which has more than 500 out of 14,000 employees sick on one recent day. Limiting capacity is a last resort for hospitals, doctors, and healthcare officials. Facilities do it to preserve the proper care and safety of current patients, though it means leaving people in limbo in emergency rooms, making ambulances wait, and postponing treatment for cancer, heart disease, and other conditions. While some hospitals say they are asking doctors to move quickly to discharge patients, to free up beds, asking remaining staffers to work overtime, hiring any available temporary nurses, and enlisting volunteers and relief workers, including the National Guard. We're living in a world of trade offs, said Ron Walls, a physician and chief operating officer at Mass General. And he said, which has 2,000 of its 82,000 employees test positive. Hospitals turn to last ditch measures as other critical employers, from airlines to police and fire departments, also struggle with workers calling in sick. Yes. And they brought up a very good point. I was looking at some stories last night. Police departments and fire departments and EMTs are also going through a lot of call outs. So, the number of hospital voluntary reporting critical staff shortages. The federal government climbed about 9% between New Year's Eve and January 6th. How many hospital staffers are calling in sick and the number of beds lost nationally aren't available because those figures aren't specified in U.S. Health in Human Services Department data. Well, that should change, being that everything has changed in America. You're going to have to do things and report things differently now. Doctors and hospital officials interviewed by the Wall Street Journal said they have cut capacity between 3 and 10%. And that is because of staff shortages. Members of the Association of American Medical Colleges, a trade group for medical schools and teaching hospitals, report that 5% to 7% of employees are out sick. Those are big numbers when you're talking about staffing a hospital. Dr. Orlowski said, wow, this month the District of Columbia and 14 states, including New York and Illinois, have reported record number of hospital patients with confirmed or suspected illness. At 26 hospitals in Illinois and Wisconsin, owned by Advocate Aurora Health, the number of patients have increased to record numbers recently after doubling in the past month, said Mary Beth Kingston, the system chief nursing officer. The system hit a record of 1,224 on December 29th, and the numbers have since climbed to 1,648 as of Saturday. So roughly 92% of patients didn't get anything. That's what they're claiming. Okay, employees who have called in sick have also worsened staffing strains after some nurses left to retire early or work for traveling nursing agencies that, of course, they got offered higher pay, so they took that. And look, that's not bad. All you do is travel from house to house, and you don't really have to stay there long with the patient. So I guess they would jump on that. So, ladies and gentlemen, wow, what a mess. To help plug the gaps, the system has hired some temporary nurses and employees have picked up extra shifts, Dr. Kingston said. Yet the system still had 50 beds closed at Advocate Trinity Hospital in Chicago. And the nearby Advocate South Suburb Hospital as of Friday. Mm-mm-mm. And yeah, I did hear about California is making their nurses work sick because it is such a dire situation there with staffing that they can't even let them take time off to quarantine or recover. I would like to see how long that's going to last. I think that's going to implode on California. I really do. But y'all, this is crazy. So, about 3,000 of the Cleveland Clinic and 52,000 employees in Ohio and Florida were homesick on an average day. Wow. So they're averaging about 3,000 sick per day. That is, how the hell do you stay functional? Oh my goodness. So Ohio has deployed the National Guard, and the National Guard has sent 220 members to help fill in. That is absolutely crazy. So Cleveland Hospital, university hospitals that are based in Cleveland, said about 2% of its roughly 30,000 employees are homesick daily. The system redeployed remaining staffers and moved some patients across hospitals to relieve strain. but it wasn't enough. Dr. Paul Hinchey, a physician and president of the System Community Delivery Network. Mm-mm-mm. Y'all, please tell me what you think. I just don't know how America's going to go on like this. This can't be long term. This will collapse your health system if you keep going with understaff and the few people that are working or calling out. You're going to collapse. You can't go on like that long term. That's impossible. But y'all, please tell me what you think about this story. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.